Hello viewers of Neurology Channel. In today's episode we continue our deep dive into vestibular migraine, focusing specifically on the diverse symptoms related to vertigo and dizziness. Vestibular migraine attacks, according to the Barany Society criteria, typically last anywhere from 5 minutes up to 72 hours. However, while the duration is well defined, the specific nature of vertigo or dizziness can vary greatly from person to person. In other words, there is no single characteristic pattern of symptoms. The experience of vertigo and dizziness can differ significantly across individuals. From my observations, it's clear that vestibular migraine can manifest in virtually every type of vertigo imaginable. This includes external spinning or whirling of the environment, as well as internal sensations of spinning or whirling where the environment remains stable, but the patient feels as if their head is spinning. Additionally, it can involve various forms of imbalance, such as disequilibrium, wobbling, tumbling, and that general sensation of being unsteady. In conclusion, there isn't a single definitive type of vertigo that can conclusively point to vestibular migraine. Instead, it's essential to consider the full spectrum of features from the patient's medical history and examination findings. Focusing solely on the type of vertigo will not lead to a definitive diagnosis of vestibular migraine. It's important to note that vertigo in vestibular migraine isn't always spontaneous. It can also be triggered by changes in body position, meaning certain positions may provoke symptoms while others do not. Additionally, triggers can extend beyond movement and include factors such as sound, light, visual stimuli, anxiety, fatigue, weather conditions, stress, temperature changes, and even diet. All of these factors can potentially trigger symptoms of vestibular migraine. When we consider movement as a potential trigger for vestibular migraine, it's important to note that it's not only self-induced movement. Passive movements can also trigger symptoms. Many patients report that using public transportation, such as buses or cars, especially during acceleration or deceleration, can trigger vertigo and dizziness. So, passive motion can indeed play a significant role in provoking attacks. However, the Barany Society specifies that vestibular migraine vertigo attacks typically last between 5 minutes and 72 hours. It's important not to rule out the possibility of persistent or chronic vestibular migraine. In practice, I've observed patients with chronic dizziness who respond well to medications typically used for vestibular migraine, leading to symptom relief. This suggests that chronic vestibular migraine is indeed a possibility, even if it is not yet fully explored. As for the appearance of nystagmus during vestibular migraine attacks, it's not always present. The presence and type of nystagmus depend on which part of the vestibular system is affected. Since vestibular migraine can impact various areas from the inner ear, brainstem, to cortical and subcortical pathways, including the thalamus, nystagmus may resemble that seen in acute unilateral vestibular disorders when the inner ear is involved. However, many vestibular migraine attacks can occur without any noticeable nystagmus. When we examine a patient with vestibular migraine outside of an attack, we typically don't observe any nystagmus, whether spontaneous or otherwise. We must specify that beyond vestibular migraine attacks, certain oculomotor tests can still show abnormalities. Specifically, these include the saccadic test, the smooth pursuit test, and the optokinetic test. Each patient's experience is distinct, making it crucial to understand and tailor the approach to managing. In summary, vertigo in vestibular migraine can be spontaneous, triggered by head movements, body position, visual stimuli, or even certain foods, which leads to the concept of an anti-migraine diet, which eliminates specific triggers. This variability makes each person's experience unique. Thank you for joining me today on our journey through vestibular migraine. We will be diving deeper into this fascinating topic in our upcoming episodes, so be sure to tune in. Until next time, goodbye for now.